Today we are going to talk about cervical cancer, mainly from cancer screening and prevention perspective. So as you know, there are many gynecological cancers, women-specific cancers. As a company, we have been focused on breast and ovarian cancer, but cervical cancer is also a very favorite topic because a long time ago, when I was working in ICMR with Dr. Soumya Swaminathan, we were primarily looking at HIV and tuberculosis patients. And most of the women, the husbands will be HIV positive and women also get infected. So most of the women who come for HIV screening, they also had HPV infection. So there was like a dual infections, both HIV and HPV infection, because both are transmitted sexually. So we did find a very high prevalence of HPV infections in South India. But as you know, not all HPV strains are pathogenic. Very few of them are pathogenic. In most scenarios, the HPV infection automatically resolves. Your immune system takes care of it. So there's, in many scenarios, most women don't need any kind of intervention. So, but repeated HPV infections or chronic illness, which is not going away, and if there is a pathogenic strain, that may eventually lead to slowly the cervical cells, the epithelial cells, they change in nature and they can become cancerous. So HPV infection has a very strong statistical association with the disease. Also, there is a biological mechanism involved behind carcinogenesis. There are many viral oncogenes which are triggering the carcinogenesis. But HPV infection alone is not one simple factor. There are so many other factors, including genetics and other environmental factors. Now we're also talking about, just like gut microbiome, we're also talking about vaginal microbiome. Maybe that's a different topic for some other day. So the healthy microbiome is going to help prevent cervical cancer. That is a very interesting topic. I don't have slides on that today. But the microbiome does have a big role to play. Also, the mother-to-child, the vaginal microbiome, mother-to-child transmission during the childbirth, that is also very important because children who are born through normal natural deliveries are more resistant to many HPV strains compared to children who are born by cesarean section. So there is a mother-to-child transmission of the microbiome also helps in this. Innate immunity against several HPV strains and other pathogenic strains in the vaginal microbiome. It's a very interesting topic, lot of interest in that area because microbiome is something we can manipulate. But as of today, India, we do face a lot of cervical cancer. So especially it affects the poor socioeconomic group. And mostly these patients, they show up in the government hospitals like Adyar Cancer Institute in Chennai or Kidwai Memorial, or Nizam's Institute, NIMS in Hyderabad. So if you go to this kind of government public hospitals, especially on the women cancers, there are only two major types of cancers you see a lot. Number one is obviously tobacco related, the head and neck cancers, the oral cancers. And number two is cervical cancer. Surprisingly, in that segment, that's the very more prevalent cancers. So I was curious about, what is the global incidence, prevalence and incidence of these cancers, especially the WHO statistics. So there's a recent publication from Lancet. So here you can see the incidence rates and also the mortality rates. But this data is as of 2020. The paper came sometime towards the later part of 2022. On the left side, you can see the map. It's an age standardized incidence per 100,000 women years. The dark blue correlates to more than 33 and above, and the light blue is less than 5.6. So you can see most of the incidence is in the developing emerging economies or the developing countries. I don't like to use the word third world countries. That's a Western philosophy. They think first world, second world, third world. That's not a correct way. So we call them as either you go by low LMICs, low and middle income countries, or emerging economies. That's the better way to put it. So you can see apart from India, India is somewhere around 17 to 22% in that range. You can see most of this population are in Africa, especially Central and Southern Africa, also South America, and many parts of Asia Pacific, especially Indonesia. Indonesia healthcare system is very lacking in resources. They are very problematic system. They don't have enough resources. they are operating under also Bangladesh and other countries, right? So these low and middle income LMICs are the major incidence of cervical cancer. Also, the same countries are also facing the mortality. So the incidence and mortality, you can see pretty much the map, the overlaps are happening. Whereas if you see the Western countries like US, Europe, the incidence is very, very low. So one of the reasons for the low incidence is also because of they have a different kind of problems. So cervical cancer is not a huge problem for them, but HIV is still a big problem in those countries. So there's still other problems like cancer, other types of cancer more common in those countries. But cervical cancer has come down in many of the Western countries, especially US, because of the vaccines, the cancer vaccines. And the cervical cancer vaccines have been extensively adopted in those countries. We don't have a full adoption in India. So that is something that's a lesson learned. If the vaccines are adopted widely, then definitely the incidence rates will come down. We have seen that in the developed countries like US, Europe, and Canada, UK, and other places. And on the right side, you can see the more nitty-gritty details about for each region. So in Africa and Asia, and this is more detailed. Of course, the WHO Cervical Cancer Elimination Initiative, if you want, you can go and read about that. So they are talking about just like how they had this Stop TB Alliance and those kind of things. So they have an initiative to tackle cervical cancer globally, because the unique advantages in cervical cancer, it's easy to find it at early stage, just a routine screening, pap smears, and also checking for HPV. So the cancer screening programs can really help in bringing down this global incidence as well as the mortality due to cervical cancer. And this is again age standardized incidence in terms of women years for different regions. So here you can see, if you look at Asia, you can see India and Thailand still, leading. And you can see China, even though there's a huge population like India, China doesn't have a huge cervical cancer problem, still lesser than India, right? So that's something that we need to look at. So why India is is high on this graph? That is something that we need to work on this. Similar trends you can see in other countries also. So you can see there are certain countries, for example, Denmark, you can see they're still high. And also you can see France is high. And whereas you can see USA and New Zealand, these guys are a little bit reasonable, right? So wherever the cancer vaccine program has been successful, the incidence and the prevalence and the mortality, it's all under control. So in India, even though the vaccine has been available for a while now, adoption is not happening. There's a stigma among parents. This vaccine is meant for young teenage girls, and the parents are saying, no, my girl doesn't need this vaccine, right? So this is only for young teenage girls who are sexually active. So the parents are not ready to accept that. So when the pediatrician recommends, why don't you get HPV vaccine? They don't say HPV, they say cervical cancer vaccine. Then they ask more details about that. They're educated people. So once they go online, they Google it, and then they find out, oh, this is for sexually active teenagers. Then they say, no, my daughter doesn't do that, right? There's a stigma, there's a social stigma. Because of that, the vaccine has not been adopted widely. There's a friction, there's a social stigma. And now companies like Serum Institute, like how they did with the coronavirus vaccine, now they're launching the cervical cancer vaccine, and they're making the pricing more affordable. So one of the doctors I know, he was telling, even if you give it for free, there are people who are not ready to take it. So this requires a lot of campaign, awareness creation to encourage people to adopt the cancer vaccine. And there's some more data from the same publication. So here, the two main statistical parameters are the HDIs, the Human Development Index, and the estimated annual percentage change, EAPC. So whatever intervention we are doing, let's say we are aggressively promoting HPV vaccine, the cervical cancer vaccine, is the program working or not, right? What's the return on the investment? So if you want, so you need this kind of metrics to estimate how much change are we creating by this kind of interventions. And also you can, the HDI, the Human Development Index, is directly correlated with the mortality rate. So without humans, there's no development, right? So the lower the mortality, the higher it's inversely proportional. and the higher the mortality, the lower the HDA, something like that. And the estimated change is like a it's a logarithmic scale. You can see it's on the 0 on the left side, it's negative, on the right side, it's on the plus, either on a linear or logarithmic scale. So it's like a 2 standard deviations. And you can see the Western countries are skewed towards the negative side, like US and other countries, whereas the India, as you see, is a little bit on the right hand side, right? So, but then this is pretty much, they're all coming under that -10 to -2 range, right? And very few of them are on the 2 and +2 and +4. So the EAPC is an arbitrary metric, which will help us to understand where is the trend going. Is it going on the negative side or the right side? So the trend is to slowly push it towards the positive side. And I just taken the numbers for India alone. This is actually this table in the publication has a lot of other for all the other countries. So the total female population in the world is in the first line, and then you can look at the India. So this is the cervical cancer incidence and mortality as of 2020. So the proportion of all cases is 20.5%. So that's a big number, right? And the global age standardized rate is 18 per 100,000 women years. And number of deaths is around 77,000. So proportion of all deaths is around 22.6%. And also the standard deviation and the 93% confidence interval. So 20% is very, very high. So it should come down. So how can we bring this 20% all the way down to 2% or completely, it should be 0%, right? So how do we bring down this incidence and also the mortality rates? So that is the only way to do that is create awareness and invest more and more into the cancer screening programs and create awareness for the vaccines and for the adoption of the vaccines. And we need more vaccines. So whatever vaccines we have, the tetravalent or the hexavalent vaccines is not enough, because I really want to do some study like this. People have not done much work in India. What are the pathogenic HPV strains? We know that 16, 18, 19, like that. We know which are the pathogenic ones, but which pathogenic HPV strains are prevalent in the Indian women? Nobody has done that. So this is an interesting study that we can do. Then we need to develop a cervical cancer vaccine that is meant for our Indian population. Similarly, we can do it for the Africa population, like that. Every population for that particular country, which HPV is more prevalent, and we have to focus on that and make the vaccine for that particular group of vaccines. Just like how in influenza vaccines, you have two versions of them. Many people don't know this. The flu vaccine that you get in the US and the flu vaccine you get in India are not the same. One is meant for the northern hemisphere. The colonies they use to make the vaccine is different for the US and other countries. And the other one is for the southern hemisphere. Even in flu vaccine, we have two versions. So why not every population, we have to find a unique combination. What are the prevalent HPV strains? We have to make a vaccine specific for that particular group of HPV strains. That will have more efficacy in preventing the cervical cancers. And another story, recently somebody was posted on LinkedIn, why only girls? Why only teenage girls? What about teenage boys? Maybe it's time we vaccinate the boys too, right? But there have been no clinical trials. And men are usually carriers and women are the one who get the disease. So is there a scope? There are some countries, they have introduced, without any clinical evidence, they have introduced the exact same vaccine that's given to the teenage girls. We'll also give it to the boys. But we don't have the rationale. There's no clinical data to support that. So somebody has to do a trial and say, giving the HPV vaccine to boys will also help in the reducing the incidence and the mortality. Somebody has to do that study, and we have to see that. But then the logically we say, yes, it might be a better strategy. Why only girls? We should also vaccinate the boys, right? So it should be a universal. There has to be a universal vaccine, a vaccine for everybody, not only for the teenage, but also even for adult women. So we don't have that right now. So some companies have launched for adult women, but then we don't have enough studies to justify widespread use of this particular vaccines. So coming back to the main story, the cervical cancer, it starts in cervix, which is in continuity with the uterus, right? And there are two major types of cells Either it's the glandular cells which are secreting the all these secretions, the mucus and other things, and then the squamous cells. So depending on the cell or cell type of origin, so you can have two types of cervical cancer. Either you can get a pure squamous cell carcinoma, or you can get